I think the candidate who was preparing the case, he has left the meeting by mistake.
I am
Are you
available,
there?
Dr. Sadaf. Sorry. Yeah, sorry, some internet problem.
Okay, no problem. Okay.
Thank you.
So can we start now?
Yes, we can start.
Okay.
Uh,
So after 10 minutes, I will let you know that 2 minutes are remaining, right? So we can start now.
Hello, I am Dr. Al-Shazli, the doctor in the outpatient clinic today. Can I confirm that you are Mrs. Jennifer?
Yes, doctor, I am.
Ms. Jennifer, we are here today to discuss an issue related to a health condition. I will take history from you. And during my our meeting, I will write some notes. It could be confidential. It will be confidential, but all my attention will be with you. Is it okay for you?
Thank you, doctor. Thank you.
Thank you. Ms. Jennifer, how can we help you today?
Doctor, I'm having some problem with walking and it is there for a few months now.
I am sorry for that. So it's for few months?
For 6 months.
For 6 months. And is it increasing or decreasing or the same?
Yes, doctor, it is increasing day by day and it's bothering me a lot.
And have you noticed anything make it better?
Nothing actually.
Or anything make it more worse?
Yes, doctor, I have noticed that when I get up early in the morning, there is more problem, but with the passage of time, sometimes I become better. Then again, it improves. It keeps on changing throughout the day.
Okay, sorry for that. And can you tell me how did that started?
It started gradually.
Okay, okay. And have you noticed any floppiness in your legs or stiffness in your legs?
Yes, I feel that my legs are weak.
Weak. Is it on the stiff side or on the floppy side?
In both of my legs.
Oh, okay. Okay. And before this problem happens, do you have any loose motion?
No,
Okay. And have you been bothered by any other complaints associated with this weakness of the leg or difficulty in walking?
yes, doctor, I'm losing weight.
Losing weight, and sorry for that. And can you tell me more about this weight loss?
Yes, doctor, I'm losing weight for a few months also. Although I try to eat a lot, but still I'm losing weight.
Okay, sorry for that. And how much over how long?
I think I have lost 4 kg over 2 months.
Okay. And is it intentional?
No, I don't want to lose weight.
Okay. And is it associated with any change in your appetite?
No, my appetite is normal, I told you.
Okay, okay. Okay. And apart from that, any botherings, any troublings? Anything troubling you more or anything bothering you more?
Yes, doctor, I have high blood pressure for 3 years now and I'm taking some medicine for that.
Okay. And this high blood pressure, have you been investigated for it? I mean, have you been done work up for it?
Yes, I'm taking some medication for that.
Okay. What medicine you are taking?
Yes, doctor, I have a list with me. Patient is taking Ramipril 10 mg.
Ramipril 10 milligrams since 3 years. Okay. Okay.
Yes.
And apart from that, do you have any pins or needles?
No.
Or tingling?
No.
or numbness?
No.
Apart from weakness in your legs, any other weakness anywhere in your body?
At times I feel that my arms are also weak, but it's not such a grave problem at my legs are as my legs are.
Mhm. Okay. And apart from that, do you have any tiredness in the morning
No,
or tiredness at the end of the day?
no, I generally feel tired throughout the day.
Throughout the day, but it's not more in the morning or not more
No,
at the end of the
no,
day.
no.
Okay. But you told me when you start to move, this difficulty in walking improve and weakness improve.
With, sorry, with what?
You told me when you start to walk in the morning, the difficulty in walking improve or weakness improve.
Yes, doctor. Basically, when I get up in the morning, there is, you can say, the severest form of weakness in my leg. But as I move around in my house and do daily routine work, it improves. But at the end of the day, I feel that it's again there is weakness. So it fluctuates throughout the day.
Okay, okay. And you told me you have some eye weakness. Can you tell me more about this?
Some which weakness? Some weakness in my arms.
In your arms.
Yes.
Okay, and in your eyes, any problem in your
No,
eyes?
no,
Eyes.
no problem with my eyes.
Okay. And can you tell me more about this weakness in your arms?
At times when I have to place the things in the above shelf, I find it difficult and I find difficulty in combing my hair.
Okay, okay. So you have some difficulty in combing your hair, and do you have also difficulty in standing out from stairs?
Yes, doctor.
Okay, okay. And have you noticed, apart from this weight loss, have you noticed any lumps or bumps anywhere?
No,
Okay. And have you noticed any uncontrolled in your urine or stool?
no.
Have you noticed that when you are like talking a lot, your voice start to become more fainter and fainter?
Yes, doctor, you're right. My husband, he has noticed that my voice changes with the passage of time.
Okay. And have you noticed when you are moving your arms, for example, it became more weaker and weaker?
It becomes better when I do something. After some time, I feel better.
Okay. And do you have any shortness of breath?
No.
Do you have any cough?
Yes, doctor, I have some cough for 3 months
Can you
now.
tell me more about this cough?
Yes, doctor, I have cough for the last 3 months and it is getting worse day by day.
Okay, okay. Sorry for that. And apart from that, this cough is associated with phlegm, or it's dry cough?
No, it's dry.
It's dry cough. Okay. And apart from this cough, do you have any pacing of your heartbeat?
No,
Any change in the color of your skin?
no,
Anyone told you became more paler or bluish?
no,
Any yellowish in your eyes?
no.
Any tummy problems?
Any tummy problem?
Any
No,
tummy problems? Any bowel
no, no,
problems?
no,
Any change in the stool or the color of the stool?
no,
Any throwing up
no.
or feeling sick or getting sick?
I'm sorry.
Any feeling sick or getting sick?
No, I haven't thrown up and I don't feel sick.
Okay. Any history of clot or bleeding?
No,
Any joint pain?
no,
Any skin changes?
no,
Any marks in your skin?
no.
Any past medical history I should be aware of?
I just have this high blood pressure. I told you.
Okay. And any surgery in the past?
No,
Any medicine you are taking
just this Ramipril.
apart from Ramibral? Okay. Any family history if not?
Any history of?
Any family history if not?
Yes, doctor. My father, he had a condition and he was so terrible. He was having some motor neuron disease.
Okay, sorry for that. And how is he now?
He has passed away.
Sorry for that. We'll try our best to help you.
Okay, thank you.
Okay, and thank you. And apart from that, are you smoking?
Oh, yes, doctor, I do smoke and I'm smoking since my school.
And how much over how long? Sorry.
I smoke up 20 cigarettes a day since I was 16.
Okay, it's advised to stop smoking as you know, it has a lot of impact on your health. And are you drinking alcohol?
No.
Okay, and can I ask you some private questions like regarding your menstruation?
Mm-hmm.
Do you have any problem in your menstruation,
No.
in your period? Okay, are you taking
It's
any
normal.
pill?
2 minutes are remaining. It's normal, doctor.
It's what? Sorry.
Sorry, your voice
Uh,
is breaking.
any problem in your period?
No, doctor, periods are normal.
Any birth control pills?
No, I don't take.
Okay. Are you on long-term relationship?
Yes, I live with my husband.
How many kids? Do you have any kids?
And yes, I have two sons, and they are for their studies. They're abroad.
Okay. Okay. And how is their health?
They're fine.
Okay. And how is your husband health?
He's very cooperative, doctor.
And what about your job?
Doctor, I work as a secretary in an office.
And does this impacting your job?
Yes, very badly.
Sorry for that. We'll refer you to social worker to help you regarding this.
Mm,
And
that will
are you
be very
driving?
kind of you.
Are you driving?
Yes, I do drive.
It's advised to hold driving for the time being till we discuss your case. What is your concern, Ms. Jennifer?
Sorry,
What is your concern at this point?
doctor, I'm concerned that can I have this motor neuron disease like my father? I don't want to die like him. He died
Yeah,
in such a distressing condition. I'm very much afraid of it.
I am highly appreciating your concern, Ms. Jennifer. This is one of the possibility, and when we rule it out after we are taking more deep history from you, and after we examining you full examination, after also consulting some specialties, including the nerve doctor, taking his
Mhm.
opinion, and he may request some work up related to your nerve and muscles. We'll let you know, but this is one of our possibility.
Okay. So your time is up, but if you want to continue, you can, because there was some
Uh,
disruption in the voice. So you can continue.
okay. Okay, at this time, we'll admit you, we'll hospitalize you, and we'll do for you some workup. We'll give you
Mhm.
also some pamphlet and leaflets and website to explain for you more about your condition. And
Mhm.
I just want to summarize for you that you have some weight loss and some weakness in your legs and arms. And we'll do our best to help you. And as I told you, we'll hospitalize you and we'll ask nerve doctor to see you.
Okay, thank you, doctor.
Thank you.
Take 1 minute and then we will start the examiner question.
Okay.
So your 1 minute is up. So please summarize positive finding in the case and present your differential diagnosis.
Yeah, Ms. Jennifer, when I'm taking history, when I've taken history from her, she has been troubled and bothered by several complaints, including losing weight and proximal, what seems like proximal myopathy, and it seems also she has muscle disease or nerve disease. So on top of the differential diagnosis for her could be Lambert-Eaton syndrome, motor neuron disease, could be myelopathic picture, but which is less likely as the patient has weight loss. Could be also different causes of proximal myopathy, which could include endocrinal diseases, but this was ruled out by history.
Okay, so
Uh,
you are doing it very well, but I will advise you to keep a slow pace. Okay. So
okay,
first one
okay.
is Lambert-Eaton. Second, you have kept the
Motor neuron
motor
disease,
neuron disease. What
and
is the
after
third one?
that, myelopathic picture, but this
Mhm.
is less likely as the patient have loss of weight, which is not going with, I mean, it will be down the list as this is not usually going with myelopathic picture unless there is tumor or compressive symptoms above C5. And
Mhm.
then proximal myopathy for endocrinal diseases like thyroid, but again, if the patient does not have any manifestation of thyroid disease, either hypo or hyper or proximal myopathy also due to other endocrinal disease like Cushing, but the patient does not have any manifestation of endocrinal
Mhm.
disease. So on the top of the list is Lambert-Eaton motor neuron disease on the top of the list.
So how the motor
I thought
neuron
also,
disease will present?
the motor neuron disease will present with um, um, upper motor neuron lesion, usually upper motor neuron lesion in the lower limb and lower motor neuron lesion in the upper limb, and associated with recurrent aspirations and dysphagia. Uh, I mean, difficulty in swallowing, and
Mhm.
depending on the type, is it ALS or progressive type,
Mhm.
or bulbar type or pseudobulbar type. So it will depend on the type of motor neuron disease. But the
So
patient will have also some weight loss and muscle atrophy all over his
right.
body.
So depending, while considering your topmost differential diagnosis, the Lambert-Eaton myasthenia syndrome, what are the positive points in the history which are suggestive of that or supportive of your diagnosis?
Yeah, for Lambert-Eaton, the patient is losing weight and she has some cough, and her there is improvement of her movement rather than deterioration of movement. I mean, by doing exercise, she is improved, which is most likely characteristic of Lambert-Eaton syndrome, and she's also 53 years old. So it could be malignancy, like lung malignancy, that leads to Lambert-Eaton syndrome.
So what other questions would, if time would have allowed, what are the questions you need to rule out in this patient while considering this Lambert-Eaton? What other question will you ask?
I think the most important that if there is improvement on walking, if there is she has any types of malignancy, I want to dig into malignancy, other malignancies like GI malignancy or constitutional symptoms. Um
Yes,
this is the main.
this patient was having weight loss and the cough, and she was a chronic smoker.
Yeah, I want to dig into lung malignancy and type of lung malignancy, but I'm not sure which type.
Okay, so how you will investigate and treat this patient?
Yeah, investigation of this patient will include a specific investigation, mostly targeting Lambert-Eaton and motor neuron disease, including EMG, muscle biopsy, and anti-voltage gated calcium channel. And apart from that, other investigations, which include MRI for his cervical spine, um, Apart from that, the basic investigation, which include complete blood count, liver function test, kidney function test, inflammatory markers, including ESR, C-reactive proteins. Then I will approach for management, which will include multidisciplinary team, including mainly the neurologist for assessment and examination and for workup, and including physiotherapist, patient education and counseling about his condition. And after availability of the results from there, we can go.
Okay. So very well done. You have done this case wonderfully. First of all, it's appreciated that you have come forward to perform the case. This is, I think, the first step toward the success. When you expose to yourself and you subject yourself to the situation, right? So it's really appreciated. Secondly, you have reached the diagnosis and you have built up a very good differential diagnosis, and you have told us your clinical judgment is right. But there are a few things we will discuss as let me mute the other candidate. Okay, so you can unmute yourself now.
Okay.
So let's have an overview of the case. First of all, you have a very good background knowledge and you know that how to take a history and how to rule out the other diagnosis, right? So may I know that what you have prepared from before starting the scenario? What was your scheme? Have you made any differentials out there? Or
I have prepared Guillain-Barré syndrome on top because the patient has leg weakness. But once you told me that the duration since several months, so it was far from the differential diagnosis. And so once the patient has upper limb affection, also it was out of the differential diagnosis.
okay. So there are a few things we will discuss. As I'm telling you that you are a very good candidate, you have a background knowledge, you have a very good clinical judgment, you know how to ask the question and how to fulfill all the skills. And although you took, there are a few things that you repeated some questions.
Mm-hmm.
It means that you have not make your own scheme, or it's advisable that make your own notes of history or of station 5 or any station, or make your schemes of examination in rest of the clinical examination, right? It will help you in sharpening your skill. Okay? So it will save your time. Have you heard my audio I have made for history taking?
I've heard a lot, but history taking no.
Okay. So whenever patient is having more than one complaint, like this patient was having difficulty in walking, secondly she was having weight loss, and third she was hypertensive. So in that case, it's up to your choice, but I'm just telling that how to make it more perfect. Okay, so we will say, I understand that you have some health problems, so let's discuss about your difficulty in walking first. First localize and then ask weakness in any part of the body. In this way, you will not repeat the question. Some of the questions you kept on repeating, so it does not put a good impression on the examiner. Secondly, it costs your time. Okay. So secondly, when you localize that it was, you asked me and I told you that yes, there is local weakness in my leg. It was really good that you analyze that what exactly the problem is. Next, this under which system this complaint comes? Difficulty in walking.
Under neurology, neuromuscular,
Under neurology. Yes.
musculoskeletal.
Yes, you have asked all the questions, but it seems a bit haphazard to me. Sometimes you were asking about the weakness, then you move to other question, then you move to the headache and eye problem. So if you ask in a systematic order, any order you want to keep, then move to the next complaint, and weight loss is under general. Come to the next complaint of general, or asking more about, I have told you, and it's also written in the scenario, the patient's appetite is normal. Okay. So many of the differential diagnoses are ruled out. If still you want to rule out, you can just sharply ask these questions to make your differential diagnosis. And very early, within 5 minutes, you must be sure that what the patient is having and what is the underlying cause. Okay, so then you have to look for the underlying malignancy, and you reach that it is due to the lung malignancy. Just my one advice is that memorize your question, make any of your scheme, so it will save your time. And what you have missed, that is why you have missed the autonomic features that are associated with this. And you were short of time, so you did not summarize, although it was a long case. Otherwise, I would have added that I'm having some difficulty in showing, and I'm having some dizziness on standing. You asked me in difficulty while getting up for the from the chair, but there was also postural drop in the dry mouth. Okay. Yes, rest of the everything was fine. You asked me for the consent. For this patient, there is no need for the admission because this patient is having similar complaints for the last 6 months. So we will not admit this patient. This is the clinical judgment here. So we can say we will do some test. It looked like that if now you are sure that this is the Lambert-Eaton myasthenia syndrome. Regarding the motor neuron disease, we can say it is less likely in your case. Rather, your symptoms are suggestive of a condition which is called the Lambert-Eaton myasthenia syndrome. Don't be bothered by the name. It's a condition which affects some muscle. But this condition can be associated with any underlying serious disease. For that, we have to do some test to see what's going on. Right?
Yeah, right.
Yes. So clinical judgment was fine. Just one thing, that there is no need for the admission. Yes, your patient concern was fine, that you told that it is less likely motor neuron disease. You told about the myasthenia gravis. Your clinical communication was very good. Your differential diagnosis was fine. You told first one is Lambert-Eaton, you told me. Second, you told me about the motor neuron disease, but you can keep that down the list. Okay. Before that, you can keep the myopathies. And we can also keep the chronic CIDPs.
CIDP, okay.
Right. And it was so obvious that you are trying to rule out the dermatomyositis and all the conditions that can be associated with the underlying malignancies. So keep on performing, keep practicing. You are a very good candidate.
Thank you, Dr.
So thank you very much. Anyone want to add anything or ask anything regarding this case?
Dr. Sadaf, just I want to ask why autonomic features is important here. I missed why it is important and how to ask about it, and
yes.
what is it?
Yes, because this is the part of the clinical communication. You can check from the sample side. I have taken especially the scenario from the MRCP UK official site, because in this each and every skill is given that what examiners want to hear. So how the candidates are being marked. So it's part of the clinical communication that patient must take the history of autonomic involvement in this case. Okay, otherwise you will get the borderline in clinical communication. And we will ask, do you have any difficulty in swallowing or any dry mouth you have noticed? Or do you feel dizzy when you get up from the sitting? And for the male patient, we can ask for the autonomic involvement. Any problem with your intimate relationship? Okay, in this way we'll ask.
Okay.
Sorry, why they mention in the scenario that she is a non-hypertensive, and I came late. So, what is the relevance of that in this case? Why they mention she is a non-hypertensive in the scenario? What they want from the candidate? What's the relation of hypertension in this scenario?
I didn't get your question. Basically, she was a non-hypertensive, right? And she was taking this Ramipril. I didn't get your question basically.
I mean that she is in the scenario written that she is a non-hypertensive.
Yes.
Is there any relation of hypertension to?
No relation. No relation. No correlation between being and hypertensive. For the postural hypertension, that can be the cause. But he have asked me that for how long I am taking this medication. I told that for the last 3 years, and he confirmed that. So the doctor who has performed if we ask that, can you show me your medication list? It will save much of your time. And you have taken past history 2 times. So make a scheme and you will get 20 out of 20.
Okay, thank you, Dr. Sahab.
Even if there is suspicion of lung malignancy, there is no need for the admission. There is a question in the chat box. No need for the admission even then.
Ma'am, regarding the stroke, if I suspected when patient come to with difficulty in walking and hypertensive patient, and according to myasthenia gravis and MND, actually, what are the specific point I should ask from evaluation in this case, ma'am?
Have you heard the history framework?
Yes, ma'am. Regarding the myasthenia gravis.
Yes, if this presenting complaint was from the nervous system, if we ask the questions, I think there are 15 questions from the neurology, it will rule out every differential diagnosis. So we can ask that when he asked me, he specifically asked me that anything which makes it worse, or what happens at the end of the day, what happens when you get up early in the morning, because he got it, that it is related to something neuromuscular problem. So he was suspecting either myasthenia or this Lambert-Eaton. So that is why he quantified there and cleared it there, that it's fluctuating. Early morning, it is worse, and that it improves. He asked me, what is the effect of activity? Does it improves? I told that, yes, it improves, that, but it keeps on fluctuating. The reason for fluctuation is whenever the patient sits, it again become more weak, and with activity it improves.
We can put pheochromocytoma as one of differential due to weight loss with normal appetite and there is hypertension.
Pheochromocytoma? No. Pheochromocytoma, the patient is not. What were the positive things in the history? Excuse me.
Yes, feel dizzy and
yes,
feel
when
dizzy
we will summarize the
and
case,
fatigue and with normal appetite, weight loss with normal appetite, and there is hypertension.
When we will summarize the case, the positive things are this 53-year-old Mrs. Jennifer presented with complaint of fluctuating weakness in the lower limb. For the last 6 months, she has lost 4 kg weight over the period of 2 months with normal appetite. And if we have asked the other questions, the positive thing that she's also having dry mouth, or she feels dizzy when she gets up from the sitting. And she's a chronic smoker, and she's having cough for the last 3 months. So my most likely differential in this patient includes, in order of, in descending order, we would have the differentials. So when we add the fluctuating, so it quantifies the diagnosis. What is the role of leg weakness or proximal myopathy in pheochromocytoma?
So what can we consider in the view of this weakness and cough and smoking, polymyositis?
Yes, polymyositis, dermatomyositis, these are one of the differentials, because dermatomyositis can be associated with any underlying malignancy.
It would be the second differential. Yes.
So first one is Lambert-Eaton myasthenia syndrome. Second one, we can keep myasthenia gravis, although the patient's weakness improves with the activity. So in this way, we will defend and rule out. Thirdly, we can keep dermatomyositis, polymyositis associated with underlying lung malignancy. Okay. At the fourth, we can keep that patient can have the chronic inflammatory demyelinating polyradiculopathy.
Dr. Sadaf, when you gave the history of the speech, you mentioned that the speech is getting worse through the day.
Yes.
So this is, speech will get worse, but the weakness will not.
No, I didn't say day by day. I said his husband noticed that his speech fades with the passage of time. Throughout the day, it changes. So it's again about the muscle involvement. Right? And good question he has asked was to see the severity. That patient is having any shortness of breath. If patient is developing any shortness of breath, then we will admit this patient. Otherwise, there is no need. We will just tell the patient what he is having, she is having, and then what investigation test we'll do. Some of the tests we will try to do as early as possible. In those tests, we can check the lung function test to see the vital capacity.
Okay, so speech will not be considered one of the red flag.
No,
Right.
speech is not involving just due to muscle involvement. In such patients, when muscles become fatigued, her voice changes.
Okay, thank you so much.
Yes. Any candidate wants to add anything?
We will not do any serological test.
Yes, regarding investigation, we will do. We will do the basic blood test to rule out any infective and inflammatory marker. The rest of with every muscle involvement, we will do few tests. These are the serum CK activity. Okay. Next, if indicated, then we can take the muscle biopsy, electromyography, and conduction in the study in every muscle involved. These are the investigations. Next, related to the differential diagnosis for this Lambert-Eaton, we will do, and if we have kept and history has guided us for the myasthenia gravis, we will add that investigation. So we can add the anti-voltage gated calcium channel antibodies or anti-acetylcholine receptor antibodies, right? And then we will do tests to look for the underlying malignancy that will involve the chest X-ray and the CT scan of the chest. Or if the patient she's a female patient, this can also be associated with ovarian malignancy. So if history is suggestive of that, we will do that. But in medicine, usually it's associated with the lung malignancy. So first we will do the basic blood test. Then we will do test to rule out or confirm the muscle disease. Then the specific antibody, and rest would be to see the underlying malignancy.
The treatment of this syndrome.
It's symptomatic. First of all, we will involve the multidisciplinary team, which will be the neurologist, pulmonologist, and at the same time always involve the occupational health physician and the social services to make the patient's life more comfortable and independent at the job and at the home. Okay. You can make your sentence according to that, so you will not miss anything, because this patient was needing the occupational health physician help. And secondly, he haven't asked about how she is managing at home, so maybe she's needing support. No, he has asked that how his husband is doing. I told him that he is very supportive. Okay. So regarding the treatment for the this Lambert-Eaton, first of all, we will do the diagnosis and treatment of the underlying cancer. Then immunosuppression can be given. Okay. And IV immunoglobulin therapy or plasma exchange. Sorry.
What about calcium dihydropyridine?
Sorry.
Calcium dihydropyridine. Calcium.
Yes. Yes. Diaminopyridine.
Yes.
Is yes. Diaminopyridine is under trial. Okay, then rest of the treatment would be symptomatic.
Thank you.
Dr. Sama, do you want anything?
Really, thank you, Dr. Sadaf, for this session. Unfortunately, I joined late, but it was a nice one. Regarding the red flags of the muscle of the myopathies or proximal muscle weakness, we know the 3Ds: the dyspnea, the dysphagia, and the dysphonia. The 3Ds are red flags. And Nothing to be added. Thank you.
Okay. So thank you everyone for joining. Please, for especially those candidates, I'm again telling, because I'm getting a lot of messages of whose first language is not English. So I made that audios for them and I have to upload them on the YouTube. I was not having any intention to start that channel because I was unable to upload anywhere else. Telegram is does not work here. So if those candidates, they listen to those audios of history and make your scheme or framework accordingly, that would be very helpful for them. And then after memorizing that question, just forget about the history station, and that would be not a nightmare for many of the candidates. So if you don't have any question.
Thank you, Dr. Sadaf. Thank you.
Thank you everyone for joining.
Thank you so much, ma'am.
I will try to regulate my sessions because previously I was having laryngitis, so I missed the last weekend. Take care and goodbye and Allah Hafiz.
Okay, thank you very much also to you.
Thank you.
Thank you very much.